Hello students, today we'll move to the next unit, that is of nursing theories. Okay, what are the nursing theories? In that we have to learn the different terminologies related to the theories, then we'll move to the all theories. So first terminologies we are going to discuss, that is theory. What is theory? A theory is a set of concepts, definitions, propositions that project systemic view of phenomena by designing specific interrelationships among concepts for purpose of describing, explaining and predicting. Okay, mainly theory means what? They are having this set of concepts, they are having the different concepts, they are having this set of concepts. Okay, so in this theory we can say there is a set of concepts is there, definitions is there, propositions is there. Okay, these three things that project the overall systemic view of phenomena. Okay, so what they are going to do, that three things, concepts, propositions and definitions that provide the systemic views, they describe the interrelationships among the particular concepts. Okay, for what purpose? Of describing, purpose of explaining and purpose of predicting. That is known as the theory. Second, check concept. Second one is concept. What is concept? Concept is defined as the labels given to the ideas, objects or events. A summary of thoughts or way to categorize thoughts or ideas. Okay, mainly what are the thoughts we are having? Okay, so the labels we are giving to the thoughts, objects or any events. Okay, yeah, we can say summary of thoughts or way to categorize the particular ideas or thoughts, that is known as a concept. Example is comfort, pain, or concept is an idea, thought or notion conceived in the mind. Okay, so whatever the idea, whatever the thoughts, whatever the objects that are coming in the mind, that is known as a concept. Second definition, concept is a complex mental formulation. Complex mental formulation means in our mind what are the different concepts, they are, we can say ideas, beliefs, properties, they are coming in the mind, it is known as a concept. So it is the complex mental formulation of object, property or any event that is derived from individual perceptual experience. Okay, whatever the things we are going to perceive, whatever the different ideas, events we are going to perceive in our mind, that is known as a concept. It is an idea, it can be idea, mental image, a generalization formed or developed in the, we can say, mind. So the any idea, thoughts, any mental image we are going to create in our mind, that is known as a concept. Next terminology, that is a paradigm. What is paradigm? It is the conceptual diagram. It can be large structure used to organize a theory. A paradigm is the one kind of diagram. So we are going to use that concepts we can say we are going to use, then definitions, whatever the definitions are there. So all ideas, thoughts, that is known as the concepts. Okay, so whatever the concepts they are having in the theory development, that all concepts we are putting in the, we can say, diagram. So the conceptual diagram is known as the paradigm, that is help to organize the theory. Next one is the phenomenon. Phenomenon is any occurrence or fact that directly is perceptive by senses. It is based on the reality of what exists in the real world. Okay, so any fact then or any occurrence that is directly we are going to perceived by the human senses. Yeah, we can say perceived by the senses, that is known as a phenomena. So it is mainly we can say based on reality. Okay, whatever the reality, whatever the fact, yeah, occurrence that are occurring in the real world, that is known as a phenomena. Next one is a philosophy. Philosophy is the science comprising logic, ethics, that is rules, regulations, aesthetics, that is we can say we are focusing on the behavior, opinion, metaphysics, that is study of knowledge, and epistemology. Okay, epistemology means we can say study of knowledge, opinions, behavior, rules, regulations, and logics. Okay, there we can say we are going to do, that is known as a philosophy. It is the investigation of causes and laws underlying the reality and its inquiry into the nature of things based on logical reasoning rather than the empirical methods. So philosophy, it is a one type of science. It is a science that mainly includes the rules, regulations, logic, ethics, we can say aesthetics, how the behavior, what are the opinions, theory of knowledge, all things we are going to put together. It is known as a philosophy. We are going to investigate out the causes and laws regarding the, we can say, in the reality. Whatever things they are occurring in the reality, that we are going to do the investigations and we are going to inquire. That is known as a philosophy. Then definitions. Definitions are statements of the meaning of word, phrase or term. Okay, already we have discussed in the theory, there is a concept, there is a definitions, there is a purport. Okay, so concept already we have discussed, different terminology we have discussed. Now we will discuss definition. So what is definition? It is the statement that gives meaning of particular word, या phrase या term. That meaning we are going to describe in the statement formation, that is known as a definition. Next is the conceptual framework or conceptual model. So it is defined as a set of concepts and propositions that integrate them into the meaningful configuration. Okay, so whatever the concepts, whatever the regulations, whatever the rules, we can say whatever the dimensions, what are the concepts, that concepts and we can say propositions that we are going to present out in a meaningful configuration, that is known as a conceptual framework or model. Second definition, it is used to outline possible courses of action or to present purposes, ideas and thoughts. In the, we can say one diagram, we are going to implement all the concepts, that is known as a thoughts, ideas and beliefs we are going to put together, that is known as the concept. Yeah, whatever the action we are going to take during the course of study, that is known as the conceptual framework. So within that particular framework, we can say in the diagrammatic formation, we are going to put the concepts and course of action we are going to take, that is known as a conceptual framework. Now components of nursing theories. Okay, in nursing theories we have discussed different terminologies. What is theory, what is definition, what is philosophy, what is phenomena, what is conceptual framework. Now what are the components of theory, how the theories can be developed. So mainly there are the four components of nursing theories, that is phenomenon, concepts, definitions and assumptions. Phenomenon already we have discussed, concept that is thoughts, ideas that we are going to perceive in our mind. Definitions means we can say it is a statement that presents the meaning of any word, phrases या term. Assumptions means belief. So phenomena, a term given to describe an idea or responses about an event, situation, a process, a group of events or a group of situation. Phenomena means we can say we are going to describe particular idea that are coming in our mind, responses, yeah, any event that had occurred, any situation, any process, any group of events, yeah, any group of situation that have occurred in the real world. So that things we are going to describe, that is known as a phenomena. Phenomena may be temporary or permanent. Nursing theories focus on the phenomena of the nursing. So this is about the phenomena, that is the first component of nursing theory. Second is the concepts. Interrelated concepts define a theory. Already in definition of theory we have discussed there is a concept that we are going to show interrelationships of particular things. Okay, so interrelated concept that helps to define the theory. So concept is an important component of theory. They are used to help describe or label a particular phenomena. So particular phenomena, whatever the phenomena means, we can say events, any situations that have occurred that we are going to describe. They are words or phrases that identify, define, establish structures and boundaries for ideas that is generated about a particular phenomena. Concepts may be abstract or concrete. So concept that will, we can say, help to describe the particular phenomena that shows the, we can say, relationship and that interrelation concepts that will help for development of theory. So this is the second concept. First is the phenomenon, second one is the concept. Concept can be abstract or concrete. So what is abstract concept? Abstract concept defined as a mentally constructed independent of specific time or place, such as emotions. Okay, the emotions, that is we can say mentally constructed independent of specific time, yeah, specific place, such as emotions, that is known as the abstract concept, that is we can say constructed in our mind. Concrete concepts are directly experienced and related to a particular time and place, such as physical object. Okay, concrete concept that we are going to directly experience. Abstract concept, that is we can say mentally constructed concepts. So this is a different two types of concepts that is present during the development of theory. We are focusing, that is abstract concept and concrete concepts. Next one is the definitions. Definitions are used to convey the general meaning of concepts of theory. Definition can be theoretical or operational. Okay, definitions means what? We are going to describe the meaning of terminology, term, we can say any word, yeah, any phrases. That is known as a definition. So as the components of nursing theory, what we are going to do, whatever the concepts we have identified for development of theories, that concepts we are going to describe in this statement form, that is known as the definitions. Definitions are of two types, theoretical definition and operational definition. So theoretical definition defines a particular concept that is based on theorist perspective. Define pain as a discomfort, that is example. Theoretical definitions means what? A particular concept that is defined according to, yeah, we can say based on theorist perspective. Whatever the theorist may, whatever the theorist, they are going to develop the theory. So on the base of that perspective, we are going to develop the definition, theoretical definition. As for example, pain, define pain as a discomfort. So theorist perspective is that pain is a discomfort. So like that they will describe the definition. Operational definition means what? States how concepts are measured. As for example, reporting pain score of 3 or above. We are going to report the pain by using the pain scale 1, 0, 2, okay, scale that we are going to use for recording the level of pain. So whatever the concepts they are going to be measured, the concepts we can measure, that is described, that is defined with the operational definitions. So definitions are the statement that describe the particular concept of theory, that is known as a definition. It can be theoretical or it can be operational. Theoretical definition means what? That concept we are going to describe according to the theorist perspective. And operational definitions means what? We are going to state how the concepts are measured according to the level of measurement, how the measuring the particular concept, that is known as a operational definitions. So these are the components of nursing theories, that are phenomenon, concept, definition, and we can say assumptions. Last we are going to discuss, that is assumptions. Assumptions are accepted as the truth and they are based on values and belief. Okay, assumption means what? The particular statement or particular things we are going to consider as the true, even if it is not tested. Okay, so according to our values, according to our beliefs, the particular things we are going to consider as the truth, that is known as the assumptions. They are the statement that explain the nature of concepts, definitions, purpose, relationships, and structure of theory. Okay, so assumptions are statements that we are going to consider as the true according to our values and beliefs. Okay, so they explain the concepts, nature of concept, how the concepts are there, definitions, purpose, relationships, and we can say structure of theories that are described by the state, we can say in the statement form, that is known as assumptions. So mainly we have discussed the 4 components of nursing theories. On the basis of these components, nursing theories can be developed. That is phenomenon, definition, concept, and assumptions. Now we'll move to the next, that is goal of theoretical nursing models. What are the goals of nursing theories? So first, identify domain and goal of nursing theories. First, we have to identify and we have to plan what are the goals of nursing. Okay, so on the with the help of that, we can identify the domain and goals of nursing. Provide knowledge to improve nursing administration, practice, education, and research. Mainly, there are the 4 important areas in the nursing, that is administration, education, practice, and research. So, with the help of these theoretical models, it can provide the knowledge to improve these 4 areas of nursing, that is administration, practice, education, and research. Guide research to expand the knowledge based on nursing. Okay, so with the help of the theoretical model, it can also guide the research to expand the knowledge in the field of nursing. Identify research techniques and tools used to validate the nursing interventions. Okay, so different techniques, there are the different research methods is there, and different tools we are going to prepare for collection of data in the nursing research. Okay, so with the help of this model, we can identify the different research techniques and tools to validate the nursing interventions, they are proper or not. Develop curriculum plans for nursing education. So with the help of these theoretical models, we can develop the overall curriculum planning for the education. So we can also improve the education side by this model. Establish criteria for measuring the quality of nursing care, education and research. So we can measure the quality of nursing areas like nursing practices, education and research by the developing criteria with the help of nursing theory model. Then guide the development of nursing care delivery system. Okay, we can also focus on the nursing care delivery system. So it can be also guided by the model. So with the help of that delivery system, we can give the nursing care to the patient. Provide systemic structure and rationale for particular nursing activities. Okay, so it can help to structure out the particular action, particular nursing activity, and we can say whatever the activities we are going to perform. So it is providing the rationale for particular nursing care or particular nursing activity. So it is also help for provision of rationale and structure of nursing activities. So these all are the goals of nursing theories models. Okay, in next session we'll start the types of theory. Okay, so up till now we have discussed different terminologies, then components of theories, that are 4 components, that is concept, phenomena, definitions and assumptions. And we have discussed the what are the goals of nursing theory models. Thank you. In next session we'll move to the types.